Okay, well, welcome. Today, we're very excited to have Chau Nguyen, a graduate of the Graduate College of Social Work at the University of Houston, who works with Houston Area Women's Center. But Chau, let me turn it over to you to have you introduce yourself. If you could tell us just a little bit about when you graduated, what your role is with HAWK, and what your job was pre-pandemic on a normal day.
Okay. Thank you, Dean Dettlaff, for the opportunity. I am a proud social worker through and through. I am the Chief Public Strategies Officer for the Houston Area Women's Center, and we support survivors of domestic and sexual violence and sex trafficking. I graduated from U of H, go Cougs, in 2010, and it occurred to me that's 10 years ago. Of course, I have an almost 10-year-old child. I was pregnant when I graduated, so I have some fond memories of the university and the students and the colleagues and the friends I've made, I believe now for a lifetime. Prior to going to school, this is my second career. I was a television journalist. So I worked in the Houston market for a number of years. For about 15 years, I dedicated my life to being a reporter and an anchor. And people ask me so often, how do you transition from, working as a TV girl to doing this? And I said, the transition is actually really easy. And I think you'll appreciate this, Alan. I felt like I was a social worker in training all those years because I would come to the scenes of people who were in true crisis, right? And really got a front row view in the front lines of true disparities, inequities, injustice, oppression. So that's what really spurred me to become a social worker.
Oh, wow.
Yeah.
Okay, so now, what's your job like now with HAWK?
Oh, my day job.
What's your
Yes.
day-to-day?
So I feel like I have the dream job. So Chief Public Strategies Officer is really a really fancy term, but what I do is I am in charge of all strategic partnerships, advocating for policy change, culture change in our community, movement building. I have a team of marketing and communications coordinators who handle all media relations, social media, marketing. So on a day-to-day, on any given day, we manage all media inquiries. We are often called as thought leaders in our community to address the issues of violence and raise awareness, share our mission and message, and obviously reach out to the survivors, our clients. I'm also in charge of strategic partnerships. That's looking at all of our partnerships and in our community, whether it be community-based organizations, law enforcement, health officials, academia. So yeah, we wear a lot of hats because we're a nonprofit, but I feel very lucky that I can affect change, culture change, and how people look at interpersonal violence on a broader scale.
Great. Yeah, it's such an important job. Yeah, everything you do is so exciting. But
Yeah.
how has your role changed now that
Yeah.
we're dealing with this pandemic? What are things like now?
Well, we're doing a lot of what you and I are doing: Zoom calls, go-to meetings. Our staff, administrative staff, and counseling staff are doing everything virtually. So we're remote working. That's been an adjustment. It was kind of a quick adjustment, right, for us. We were already getting our technology ramped up and moving into other forms of software. But with this pandemic, it's forced us to look at our services differently. For me, we just do these sort of check-in and I can do everything from home. I think the challenge for our staff is, the counseling team is not able to do so face-to-face support groups. And those are so important for the clients and survivors. Our shelter remains open 24/7 still. And of course, just, enacting all the CDC protocols in terms of social distancing and sanitation, et cetera. But yeah, we've had to do a quick and serious pivot. And what we're seeing right now is a spike in hotline calls, a spike for requests for shelter. So that's got us very worried as an organization and as a movement, right?
Yeah.
Other sister agencies are sharing the same stories. And, we're seeing reports on the news. We're talking to our police officer friends and they're seeing more reports of violence and family disturbances because of the stressors. So yeah, I think as an agency, as a staff, we've completely made that virtual adjustment hurriedly, but we had to, right?
Yeah. So in terms of the clients that you were seeing that weren't in the shelter, that's all moved online, and then the shelter stays open. I have read the reports about the increase in violence due to all the stressors. What's the capacity at the shelter? What's that,
So
particularly with
yeah,
the social distancing measures that you're trying to pay attention to now?
it is hard. I mean, I just got off the phone with our shelter director, who's also a social work alum from U of H, and I said, Pamela, how are you doing? How's the staff? How are the clients? It's just constantly reinforcing, keep your social distance, stay in your quads, right? It's challenging, but wash your hands. We have sanitizer, hand soaps, signs all over the building, but we have to manage. If we don't keep the shelter open, we've got about to 120 women and children who will not have a place to stay. So it's an issue. Um, Doing the best we can. The HISD just opened up their school. We have a school within the shelter this week, so that's been challenging. This morning we have we do daily calls. We had 15 kids in school, and we just manage and do the best we can. I mean, I will say that those advocates and counselors and staff they're angels, because I mean, you're really doing God's work if you're managing a place where there is a lot, densely populated, and a lot of people.
Right, right, right. So what's the capacity then if the need does increase for people to be sheltered?
Well, what we're doing right now is we're doing something called our Safe Harbor program. We put we put up to, I think, 13 families so far in something called Safe Harbor. It's the hotel voucher program.
Hmm.
And we're just doing it, Alan, without a budget. We're just like, because it's important, right? If they meet a high lethality threshold on the hotlines, then our advocates will make sure that they go into a Safe Harbor, a hotel, that we have a relationship with. That's going to be a challenge, and we'll just figure it out as it comes. But we know that need is urgent right now, and it's pressing. And there's some people who call who aren't going to get shelter, and so the best we can do is offer support and give them some tips and advice on how you manage and cope if you're living with your abuser in your home and you can't get out because there's nowhere to go. Right?
Wow, that's tough. That's tough.
I know it is. It is.
What about the people who are in the shelter then, your staff and the residents? Do they have protections? I mean, you talked about the sanitation. Do people have masks? Do they have access to masks? Do people feel safe?
So our staff, I think the county and the public, or the county and the city public health officials just sent over sort of a supply of PPEs for the staff should there be something happen. Should something happen if somebody tests positive. So far, knock on wood, things have been cleared. So our staff is ready with masks and gloves, but with the clients, they just have to stay very, very clean, keep their hands clean, use sanitizer, keep their distance. So that's what we've done in terms of making sure that things are as safe as it can be for the staff and for the clients, right?
Good. That's good to hear. What about, are you having any challenges getting the same amount of resources that you would have in the past, like food, sanitation products, all of that?
We did initially, but because we have a company we use right now, we're okay in terms of, look, we budget for food. The only additional expense we have is more food for the staff, right? But that doesn't seem to be a pressing matter for us right now. Sanitation stuff, we've got a company. I think for us, what's going to be pressing is who really is going to support the agency. And I'm sure a lot of agencies are feeling the same amount of uncertainty, which is how do we move forward in donations and our typical fundraising calendar, those kinds of things.
Yeah.
We'll have to take it, day by day. It's Sexual Assault Awareness Month. April is sexual assault. And so we've kind of had to shift everything virtual online. Our prevention educators are looking to do everything, movie watch parties online, those kinds of things. But yeah, I mean, look, resources are going to be an issue in the coming months, but we've committed as an organization to keep the staff and to maintain operations. And if we need to take a loan, we'll take a loan. If we need to dip into reserves, we'll dip into reserves. We're going to ride this out though.
Yeah. Because
the clients need it. And I think the need, Alan, in the next couple of months will be even greater. Right after Harvey, we saw 45% increase, a surge in domestic violence murders in Houston.
Wow.
And that because of it's a crisis, right? So that stress triggered violence. And we liken and we fear that we're going to see that again based on just in the last few weeks, hotline calls. There have been a couple of domestic violence murders in our community. One that was just really difficult to hear about. We're going to brace. We're going to do what we can.
Well, you mentioned Harvey several times, and I've been thinking about that a lot just in terms of the parallels between that because it's so recent. And one of the things that we see in times of crisis, and we definitely saw in Harvey, that these crises kind of expose some of the larger inequities we face in society. And sometimes the people who are the most vulnerable are the people who are the most impacted. How are you seeing that play out in your work?
I feel like we're not even seeing cracks. I feel like we're seeing massive fissures. I mean, we're talking about, income disparity. We also serve an immigrant community. Largely, half of our non-residential clients identify as Latina, right? Latin families not coming forward, not being able to go to school, right, and be fed, not having access to computers. I think the list of inequities can go on and on. Not having proper access or the fear of going, to health care officials because you're worried about your immigration status. And then on compounding with that, living with an abuser who might be threatening, your livelihood or your safety with COVID, right? So I think across the board, we're taking a look at so many different things that reveal themselves during this crisis.
I think that's been a really consistent theme in all of these interviews that I've been doing, how glaring these inequities are. I've been trying to spend a lot of time thinking about what are some of the opportunities we can think about while we're in the midst of this crisis. What can we learn about how we might do things differently? I kind of think about it as expanding our moral imagination to think about when we're past this crisis, are there ways that we could respond to the challenges in our society, interpersonal violence being one of them, the homeless population, people who are undocumented? How can we be thinking about this differently so that we might just respond as a society differently so that the next time there's a crisis, there's not as many people disproportionately impacted?
I really love this sort of moral imagination concept and the idea that there's a possibility that we can shift, right? To make sort of a broader shift in the way people look at violence. I think for us, we continue to share the message that this is a public health crisis and it affects everybody. And I think that this pandemic will reveal more of that, right? That when you look at interpersonal violence, that might be a private matter, but it spills out into our communities, right? So that first responders are affected, family members who are witnesses are affected, and then systems are affected, right? The public school systems, the communities where these families live. If we were to look at sort of a moral look and a moral imagination, I would hope that people can see that this is everyone's problem and we have to commit to do better to reduce interpersonal violence in our communities because we're going to see it more.
Right. Well, what are some of the things that you know of that you would want our students to know of? Interpersonal violence happens because of other problems in society. And it doesn't happen in isolation. What are some of the structural issues that we need to be addressing, changing, so that there's a reduction in interpersonal violence?
Yeah, there's like this whole shift in how it's a culture shift, that to know that, interpersonal violence doesn't happen in a vacuum, right? That it begins very young. And so this concept of violence prevention that happens in the primary level, starting with children and moving to adults. It's like how we treat each other and how we engage in healthy relationships. Those are the underpinnings of reducing interpersonal violence, right? Really looking at sort of that advocacy piece, because we can shift. I have a lot of faith that we can shift this pendulum, move the needle, so to speak. But we need more advocates, and we need more. We need to dig deeper on those policies. We need to, ask for increased funding, those kinds of things. So more advocates in our line of work would be so helpful. And I think social workers with that voice and that lens to look at sort of the systems, right, and how that affects how it goes from sort of not just the interpersonal, but how those policy changes can impact entire communities would be really wonderful.
I was just thinking, it shows that there's some problem in our society, or multiple problems in our society, that when we're in crisis and when our stress is elevated, then we react with violence, or that violence goes up. You know,
Yep.
it just points to something that we should be doing differently from early on, like you said, from childhood. So that's
Yeah, it's really healthy relationships. I mean, we teach primary prevention, stopping the violence before it happens
Mhm.
in the schools. And that's one of the it's the social emotional learning component that I think really needs to be injected in the schools. I think you can really see a shift, and that's what we continue to advocate. I mean, we push very passionately about bringing sort of those components of learning right into our education system. We'll continue doing that. I hope that people, because so many of us have such a personal connection to knowing somebody who's been abused or being abused themselves, that, and as we see it and it happens in entire communities, maybe this might be sort of the launching pad for change.
Yeah.
That's my hope. That's my moral, what do you call your moral imagination?
Yeah,
Yeah.
yeah. I hope so too. I hope so too.
Mhm.
So last question, what can we in the community, and our students, our college, the broader social work community, do to help your agency, particularly in a time where we're social distancing? With Harvey, we were able to be out there in the trenches and doing everything
Yeah.
we can. And now I'm not wanting to provide opportunities for our students, volunteer opportunities where they have to be with clients. In the absence of that, what can we do?
Yeah. Hey, you know what? I love social media and sort of the broad reach that social media has. Share our stories. It's Sexual Assault and Child Abuse Prevention Month, Awareness and Prevention Month. Those are really important topics, right? And there's so much that people can learn and engage. I think sharing our stories, heading to our website, going, liking our page, and being sort of a online advocate. We're always looking for armies of
Mhm.
people and friends to support our movement. I think that's an easy way to get engaged for now. And, you know, then we can have that broader reach.
Right.
Um, it's funny, Alan, about a year ago, I posted a photo of just an empty shelf of food. We get food donations for our clients. And that picture went viral. I mean, it has something, people and food and that willingness to help. We had to convert entire conference rooms into like food pantries, and just trucks of food came to us. And we're not even, but because people have such, and that's the kind of impact that social media can have. Share your stories, right?
Mhm.
Yeah, so I think that those are really important. We will continue to do that. We'll have stories from the hotline and our advocates and what they're going through in the shelter and their staff. So yeah, I would encourage your students and the university, if you have time right now, please. Yeah.
That's great. Well, thank you again for your time. I know you're incredibly busy in the middle of this pandemic, and I really appreciate your time. I know that our
I appreciate,
students, our community are going to learn a lot from this.
I appreciate it, Dean Dettlaff.
Okay. Thank you, Chau.
Thanks.